Hello, Dr. Sarma, and welcome officially to the Kaigo community. I am very happy to have you here today, where I can find out in a bit more detail about what it is that you do, but also so that everyone else can too. So thank you for being here and welcome.
By all means, thank you so much for having me here. So I'll just go ahead. My name is Dr. Rakesh Sarma. I'm in Atlanta, Georgia, and I have an integrative and functional medicine practice. And I've been doing integrative medicine for about maybe 10 plus years and have my own practice in the Sandy Springs area in Atlanta. We do integrative medicine, functional medicine. I do a lot of my coaching, especially with my clients. I use different aspects of coaching with the Enneagram and also with somatic experiencing, which is a trauma-based technique that I've learned over the course of years and been trained in, as well as other forms of coaching. So I really like to get to know my patients from a perspective of, holism. And, that's a very easy word to say, but to catch the depth of somebody and just be with them in the moment of that depth when they're open and just sharing who they are. That's one of my greatest passions, is to understand and help them find their wholeness again.
And so what kind of people do you find that you help? Is it mixed, or do you find that you commonly kind of treat the same kind of things?
It's mixed. It can be anything from someone who has high blood pressure, diabetes, high cholesterol, heart disease. But then there's also some aspect of that that's hit somebody emotionally. For example, if there's a life-threatening moment and they've had some heart issue, we're going to work on diet and lifestyle and exercise, but also, where are they in their emotional center about it? And like, how can we help them feel, okay, this has happened, but it's not over. You know what I mean? It can be someone with depression. It can be someone with anxiety. It can be someone with ADHD. It can be how are your dietary patterns affecting you? Do you know if a certain food is creating a certain reaction within you? And have you been paying attention to that? And if that's the case, what's keeping you with eating that food? For example, it could be someone who's rheumatoid arthritis or some other arthritic condition with generalized, arthritic pain. And so again, another dietary lifestyle measure. And also it could be something as simple as what part of them from a coaching perspective holds on to pain. A lot of times I've been very amazed with how pain can, especially with the somatic experiencing technique, in the moment can be shown that pain can actually feel safe for people. They become identified with it so much. And for whatever reasons, that is actually what their safety zone is. When you get to that level with somebody and they're willing to look at that for themselves, then we start looking at other ways and techniques to help them shift out of that place while they're instituting their nutritional changes and exercise patterns and so on and so forth.
It sounds like your days are varied. I guess you don't have any 2 days alike.
No, because the cliche is no two people are alike, and that's true. There are general patterns that are to be observed, but everyone has their own uniqueness and their own individuality in their life experience. And so harnessing their experiential quality is what I spend the most time doing. If they have values that are internally in conflict, which is something that the Enneagram taught me. For example, someone may be a giver and they feel so conflicted because they feel like they have to give to the point of losing themselves and costing themselves and then fatiguing themselves. I also coach physicians and healthcare workers in terms of burnout. And I find that that's a very common thread, is that there's that feeling that I have to give. And if I don't give, then I'm either bad or, there's some sort of inner critical voice saying that. And then when does that orientation start developing to biochemical anomalies? And then where along the spectrum does that lie? So, that's where I like having all these different hats. The functional medicine hats helps me see when the biochemical abnormalities are starting to manifest based on a certain orientation. And the integrative hat says, okay, what are the different methods we can use to sort of combat that and assist in kind of moving back to a sense of balance. And then if the conventional is necessary, at that point, it's become, pathologic to the point of commonly recognized conventional medicine, then utilize it wherever the person is, whatever the person needs based on their moment. There have been times where I've seen patients who came in for simply blood pressure medicine. I'm remembering this case. This lady came in, she had her commercial driver's test. So her entire focus was, I have to get my blood pressure lower. Well, of course, you can imagine that was actually driving her blood pressure higher. So even though we were adjusting her blood pressure medicine, I wound up telling her a story to carry with her. And then I remember like a couple months later, I got this great letter saying, and I remembered that story while I was taking my test, and I passed my commercial driver's license test. Those are simple things that can shift a person's orientation towards their state. And in addition to the biochemistry, in addition to the pharmacy, in addition to the nutrition, whole means really all of these aspects are occurring within the same person. There's no separation. And so finding a way to orient towards that wholeness is what I think is just needed.
When did you decide to, because I don't speak to many doctors that are also doing coaching as well. Mm-hmm. So when did you decide to kind of combine those two? What led to that?
I think when I did the somatic experiencing work, which was a trauma-based technique, and I was on my own personal journey, to be honest, and determining that, wait a minute, just talking to people about their life situations and seeing what was happening was revealing a lot more about the overall situation than just plugging in a medication. I remember one patient, she was, I think, 22 or so. She came in for a recurrent chest pain, first time I'd seen her. And she'd been in the hospital 17 times for chest pain in the ER. And I was like, okay, so they've done a lot of work. They've done the EKGs each time. They've done CAT scans. She was still having recurrent chest pain. And so we started talking a little bit, first visit, and it turns out that she had just moved to the area. She was a single mom. She was in a relationship that she didn't feel very stable about. And so we pinpointed that sense of instability. And I said, well, where do you feel that in your body? And she said, and in that moment of like with the process, she felt it in her chest. And so that correlative, okay, this is how I can manifest what my stressor is doing on a physical level. And before, of course, it gets to the point where conventional treatment or even some forms of integrative treatment are necessary. Sometimes even just that realization alone can shift people out. But otherwise, then you use something like maybe an adrenal adaptogen to help with her stress, something that can help kind of mitigate while their awareness takes over to say, okay, I'm in this place. I know I don't have to be there, but I understand the reasons why it's happening. And a lot of times, just helping people understand the reasons why it's happening. I've seen people and worked with people with their anxiety and even felt that same place of I feel safe when I'm afraid. Very interesting place to be. So how can you possibly separate that in a person until they're willing to look and see that for themselves? One of the approaches that I say very commonly is if people want to be seen and felt and heard. So approach them non-judgmentally, leave the space wide open for whatever can happen, whatever happens in the moment, and they can let themselves see what's going on. And I think giving them that safe space becomes imperative to that process unfolding, while the other things like the herbals, the supplements, if medication is needed, the medications, there are nutritional changes. And so all of this, so from a coaching perspective, coaching is intertwined within my practice because there's not even a single patient that goes by where there's not a coaching moment or something that arises. I'm remembering one patient. It was very funny that he came in for a toenail fungus, and it wound up being more of a long discussion in terms of what was making him sad, especially during the early point of COVID. These are whole beings; they're whole people, right? And so, a lot of times we need a little bit of time and place, and it doesn't really have to take a long time. It could even take 10, 15 minutes. It doesn't have to be an hour-long, visit. Sometimes just concentrating focus and attention in a just an open format can be all it takes for someone to say, oh, this is an orientation towards my health I hadn't looked at before. And if I've provided that, then I've done my job. Because there is, I think, a tendency in our culture to project you, the expert, be in charge of my health. And the reality is that I don't think that that's even possible. The best I can do is listen to you and see how you can find your own health for yourself and find all the tools, techniques, anything I can, whether it's a story, whether it's an herbal, whether it's a supplement or a group of supplements, whether it's a protocol, whether it's a series of medications. There are many times where I put people on medication because they're saying, I want to be on a natural form. I'm like, I agree with you. I want that too, but your blood pressure is now 170 or 180 over 120. The last thing I want is for a heart attack or a stroke or something much more major or catastrophic to happen. And therefore, at that point, I'd rather use blood pressure medication for an interval of time, let's say 3 months, 6 months, however long it takes, until those dietary measures are taken care of, until those lifestyles and the stressors and how we orient towards stressors are talked about. Another patient comes to mind, young man, like extremely fit, like so fit. And he was like, I'm very fatigued. And I'm like, what's going on? And so, of course, we did a blood work panel. We looked for as much as we could look for in a first visit. But also within the first visit, I found out that he was going through divorce. And so I said, from a coaching perspective again, I actually was a little bit brave with my language. I said, can I suggest that you may be hearing something? And is this a kind of self-talk you may be hearing? He's like, go for it. Say whatever. I was like, are you hearing you're a bad father? Because he was about to engage in a divorce. And it was just like, boom, that silence clicked in. He heard that stressor was happening. He was mirrored just right. And I remember at the end of the visit, he didn't say anything, but he just kind of like looked me in the eye and kind of like gave me a wave with his hand. And it was like we both understood, just from the human to human perspective, like, okay, I don't have to treat myself like that. And that was also creating a lot of the fatigue. And again, the biochemical needful is still done. All of that can be done. So, as I said, I think weaving a coaching conversation in with a visit becomes as paramount as the treatment that we're giving. I think that's one of the centers of holism, at least as I see it. There are other practitioners who have an even greater breadth of experience with that. This is, and I'm always trying to learn something new.
It's interesting what you said about some people feel more safe when they feel fear. And what came to mind, I said I wouldn't go off on tangents, but I know we'll definitely talk about this at length, but it just came to mind, so I wanted to share. I remember when I was in my early 20s, the first time I ever went to a therapist, and I'd been through a lot of like dysfunction and trauma in my childhood. And I don't remember much of the conversations we had, but I remember one thing she said, and it was that she thinks I'm addicted to fear and worry. Sure. And I just couldn't get what she meant. Like, when I weren't in a state of fear or worry, I would look for things. I would actively think about things I'd usually worry about to find something to just grip onto.
Well said. Well said. That's exactly my point. And one of the most important things about addressing that is don't allow any judgment with it. The natural compassion, when someone is suffering, that happens, let that just fill the room. It doesn't have to be like a coddling type of compassion. It can be just the natural sense of, okay, this person this is what they're suffering.
Yeah.
Very basic orientation. That helps tease out that place between, whatever that sensitivity is that's underneath, that requires that attention, that says, I feel afraid. I'm going to go here because I think it's important. People underestimate the value of mindfulness techniques and self-centering techniques. A lot of times I think it's poo-pooed in a direction that I don't think is useful. It's really about seeing who you are, and am I really this fear? Am I really this anger that's happening? Am I really this whatever that's happening that feels uncomfortable or whatever? Or am I even this joy that's happening, right? Whatever it is. I think I've learned over the course of years, and I have a daily practice that I do. And if I didn't do that practice, then I would feel like I hadn't eaten for the day. And, one size doesn't fit all. There are thousands of practices out there. For some people, that may be dancing. For some people, that may be mowing the lawn or gardening. For some people, that may be playing golf. But if they're doing it just from one place of like pleasure, they may not be getting as much as they could out of it. In some of my physician clients, for example, who I coach, and my healthcare clients, I remember one client I had who was giving, like we talked about. And I said, okay, what do you love to do? And he said, I love to hike and I love to play tennis. I'm like, all right, it's very simple. Can you take 2 hours out of your week for tennis? And can you take 2 hours out of your week to hike? So it's 4 days a week. You know, he had a sick wife, et cetera, et cetera, et cetera. So he was caregiving at home, caregiving at work, et cetera. And everyone has that story, not just physicians. Everyone has a story of a stressor. But if you give yourself that little space for replenishment, anyway, a few weeks later, he was just like, I feel great. I didn't realize it was something so basic. And a lot of times it's just the basics that make the shift. In addition to all the therapeutics we can give, a lot of times just helping someone reorient themselves to their own values is all you need to help them heal.
And what part do you feel food plays?
You know, I joke with my patients about this. A lot of times when they're in their 30s and 40s, I'm just like, you know, in your 20s and teens, you could get away with eating almost anything. Not always true anymore.
Yeah.
And I said, but then something starts to creak around 30s. Oh, where'd that come from? And then suddenly, as you're getting into your 40s, wait a minute. And so it really just depends on, like, if you recognize your sensitivities with certain foods and what your body's response and your emotional response and your mental response is doing, then you have the power to decide what you're going to put in, what you're not going to put in. So food allergies do happen, food sensitivities do happen. They do throw people off. They throw people off their equilibrium. And so from a sense of like helping people find balance, one of my classic phrases is, can you look at your favorites? What are your favorites? And what would it be like to be without them for a certain period of time? And then I also tell people, really, this is a matter of choice. And I have been on this end of this choice multiple times. So it's not a matter. So when I use these words, I'm very careful how I use them. You either have a choice between the suffering that you're going to get with the taking in of the food, the potential indulgence of the food, or the suffering you're going to get with the deprivation of the food. For some people, there can be so many emotional aspects associated with that food. Again, this is where sensitivity becomes as key. You have to accept people where they are. And you also have to accept that if they're not ready to make a change, they're just not ready to make a change. Right? Then you have to give them other tools that you can to help them make their change or be in a place where they're ready to make their changes. Sometimes people will come to me and it won't be until multiple visits later where they can say, you know what, I checked this out on my own. You're right. I had a young lady I saw last week, and it was actually one visit. And I was just like, look at your favorites. Can you take them out for a little bit? Abdominal pain. So she stopped dairy and she stopped eggs, and suddenly her abdominal pain was gone. She was extremely excited, and she verified with him. I was just like, you're doing the work. You're seeing your own experience. So food plays, and I mean, I can't be understated the impact of food. Nowadays, one of the things I'm very commonly saying is, please remember, the food industry is an industry. It's not, this isn't a judgmental thing. It's an industry. So it's really, its primary focus is to make sure this little organ here gets satiated so that you find its product and buy its product. What's happening with the rest of the body? Generally speaking, not as much attention is paid to that. The only person who can pay that attention is the person that wants to pay that attention. Yeah. And then says, oh, I'm eating this, and I think this is happening. Okay. Yeah. And then, then it's kind of like, I don't know if I want to change this. I'm like, I've always grown up like this. I've always had this. This is one of the most interesting things about having, cultural foods. All of our foods are essentially cultural. We grew up with whatever culture we grew up with, and it became our food pattern of choice. And yet sometimes, like, an orientation towards the culture of that food can create a lot of problems. And so withdrawing from that means you have social obligations that kind of get in the way. Like, how do I tell whoever it is that's preparing the food that I can't have this food anymore? How do I go visit my parents, for example, and say, you know what, I'm not eating this? When
turning food down might seem rude.
Exactly. So many times. I mean, I've seen it in my own family. I've heard it in other people's families. I can't possibly do that. Like, okay, let's work on that social orientation that says I can't, because are you okay with saying this may cause me pain and suffering? And then is it that tacit agreement in a family structure that says it's okay to keep that? In fact, we all may be wanting something different or needing something different. It may be harder to arrange. There are so many factors, financial factors. There's, everybody has their own preferences. It may be not possible to accommodate everybody's needs, but what's the best we can do? So there's so many different factors to that. But I think you can help at least orient people towards a little bit more expansiveness towards the possibility.
And what excites you about joining a community like Kaigo?
I think part of it is there is an intentionality towards health, and there's a creativity about how that can be achieved. And so when you're talking about a group dynamic at work that's oriented towards a similar intentionality, you're talking about a very powerful medium. And so for that kind of openness to say, you know what, we stand as a big group that says there's so many orientations towards health, and these are the methodologies that we use, and whoever resonates with what, great. That's, I think there's too much of my way is the best way. I don't think that works. I think there is multiple ways. I've looked at, I wish I had all the time in the world to learn about some of the deeper levels of systems like Ayurveda, even deeper levels of conventional medicine. I'm like, man, I wish I had more time to learn so much. Yeah. So, but everyone is kind of fixated on this way, my way, et cetera, et cetera, et cetera. And I don't think that orientation is good because, people are suffering anyway. There's enough to go around. And there are enough methodologies to go around figuring out who needs what and how. Like I said, it could be a story and that's all they need. Or it could be an extremely complicated protocol that they really need to do for themselves to, make sure cancer doesn't come back. So that's what excites me about Kaigo, because I haven't delved in as much as I want, but I'm looking at the possibilities and examining in myself going, how can I, and then where do I? And, so that there's an excitement there for the possibility.
Well, we're really, even just talking to you now and hearing how many things you kind of touched on, and I was noting them down, we definitely need to hear more about this and go a bit deeper. So yeah, don't worry, all those creative ideas that pop up, we're having the exact same. So we'll be sending you suggestions and ways that we can have more conversations around certain things, because it's been lovely talking to you. And I felt just, a couple of things that you said, I know they've brought an awareness to me, and I'm learning. I'm on the journey to learning. So I know there's loads of different people watching this feeling the same. So thank you for today. Just before we go, actually, I've got a quick bonus question. And you have to say the first thing that comes to mind.
Brightness.
Okay, well, I haven't said the question yet, but let's see. So I was going to say, if there was a billboard that you were given and you could have something written on it that everybody in the world would drive past at some point in their life, what would you want it to say?
Gratitude.
Yeah.
And brightness is a close second.
Brightness. Huh?
I like brightness too. It's a close second. If there's no other additives, no advertisement, no, just the word, because it's about the experience of that word within a person. It has nothing to do with whoever's presenting that word. It's about the experience of the word within the person. Yeah. If someone experiences brightness, thank God, we need more of that. If someone experiences gratitude, thank God, we need more of that. It's not who delivered the message. It's the internal messaging itself.
What it brings. Yeah. I was going to say that when I was good, because you'd already said brightness before the question came, I was like, do you know what? It's uplifting to just see the word brightness written.
Yes.
I pictured it on a yellow billboard, and I was like,
absolutely.
That's actually uplifting.
Yeah,
that's amazing. Thank you so much for that. And again, thank you for today. I look forward to doing this again soon.
Likewise. Thank you.
Enjoy the rest of your day.
Will do. You too.
Bye.
Bye.